So today's is our topic is novel 3-dose G protein vaccine, that is ultimate key for compliances. Rabies is still a public health challenge in India. Globally, 59,000 human deaths annually, highest in India. That is a one-third that occurs out of 59. That means 20,000 human deaths per year occurs alone in India. So in every 9 minutes, one person dies from rabies. So at present, our current management, are we following WHO or national guideline for management of animal bite cases? That is in the 3 portions. First is the local wound treatment, active immunization, and passive immunization. For active immunization, we will give in 5 dose or intramuscular regime, that is on 0, 3, 7, 14, and 28, along with the rig in case of category 3 exposure. So current challenge in PEP is non-compliance. Current rabies vaccine or cell culture vaccine and inactivated vaccine are more than 50 years of old technology. That is inconsistency in potency, stability, availability, short supply, and adverse events. So in non-compliance, rabies vaccine compliant who received the full course of ARV, anti-rabies vaccine, that is the scheduled dose of ARV on the recommended dose. That is a 5 dose schedule, 0, 3, 7, 14, and 28. Delayed compliance, who completed the scheduled dose of ARV within 60 days, but deviated from the scheduled regime. Dropout non-compliance, who had taken at least 1 dose of ARV after animal bite, but not completed all the scheduled doses. So, as per WHO recommended, rabies post-exposure prophylaxis practice in view of the post-prophylaxis routine practice in view of the new Center of Disease Control and Prevention of the World Health Organization recommendation. A retrospective analysis done at a travel clinic. A total of 110 patients who were received rabies 4-dose post-exposure prophylaxis. The shortcoming in the management of these patients were late initiation of rabies post-exposure prophylaxis in travelers, administration of human rabies immunoglobulin, and antibody level is less than 0.5 international unit per ml in 6 out of 90 patients after 4 doses of vaccination. So conclusion is patients do not always receive optimum rabies post-exposure prophylaxis under real-life conditions. A significant proportion of patients did not develop adequate antibody level after 4 doses of vaccines. So, due to non-compliance to 5 doses, it proven cause of death. This is some example who was taken 3 doses of modern tissue culture vaccine without immunoglobulin, and they are suffering from rabies, and ultimate the death occurs. So the reason of death may be due to lack of administration of rabies immunoglobulin or poor compliances to vaccinations. At Safdarjung Hospital, New Delhi, out of 360 animal bite patients, 46 were non-compliant to the full course of ARV. At Municipal Corporation Hospital, Bangalore, out of 215 animal bite patients, One dose of rabies vaccine administered intramuscularly on day 0, 3, 7, 14, and 28 age post-exposure prophylaxis. The compliance rate of for intramuscular rabies vaccination was only 60%. That is, means 40% left out. Constraint for compliances to complete course of anti-rabies vaccine. The major constraint for the compliance to complete ARV was due to loss of wages, that is 47%. For regarding children, interfere with the school timing, and they left 11% left. Another reason is distance of the hospital, cost incurred, forgotten date. So next, our is evolution of rabies vaccine. Dr. Louis Pasteur first developed live attenuated vaccine from spinal cord in the year 1885 and derived from rabies one rabbit death occurs due to rabies. So then the first injection inoculated to Jessup Marriott, and that is up to 31 injection of increased immunity. After that, in the year 1911, inactivated vaccine, that is a brain nervous tissue vaccine derived, and also it is injected 14 injection for each 5 ml dose subcutaneous daily in and around the umbilicus. In the year 1976, modern tissue culture vaccine, that is cell culture vaccine, derived, and the schedule is a 5 injection schedule, that is 0, 3, 7, 14 and 28, जो कि आज तक हम यही वैक्सीन लगाते आ रहे हैं 1976 से. So non-compliance lead to evaluation of treatment regime from 31 to 5 dose and still on. So meeting the unmet medical need, introducing a novel vaccine with simple and shorter regime. So novel 3-dose recombinant rabies G protein vaccine. Novel 3-dose recombinant dose intramuscular regime, that is 0, 3, 7. Better compliance due to easy to flow regime and less visits. Convenient, ready to use, no reconstitution needed. That is, it is in liquid form, not dried form, powder form like cell culture vaccine. To evaluate immunogenicity and the safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteer. Randomized comparative controlled multicentric study out of 800 randomized, that is in 2:1 proportion between rabies and Rabipur, that is a cell culture vaccine. And the study conclusion is that the novel 3 doses was not non-inferior to reference vaccine, less adverse effect compared to reference vaccine, and the novel 3 comparative to 5 dose of WHO pre-qualified vaccine. Thank you.
Sir, thank you very much for wonderful presentation. Sir, there is a question from doctor. If
Yes.
an animal is pet animal and vaccinated, and in that case, what is the dose?
Dose is the same. There is no change in dose. Because यदि हम पेट डॉग है, यदि हम टोटली वैक्सीनेट भी करते हैं, लेकिन ये कह नहीं सकते कि इस डॉग में रेबीज वायरस नहीं होगा, क्यों कि हमने डॉग को इम्यूनाइज तो कर दिया, लेकिन डॉग में कितना सेरो कन्वर्जन हुआ, एंटीबॉडी टाइटर का लेवल क्या है, ये हम चेक नहीं कराते। इसीलिए चाहे पेट डॉग हो चाहे स्ट्रीट डॉग हो, डोज सब में सेम होगा और ट्रीटमेंट का प्रोटोकॉल भी सेम है, जैसे वॉश द वुंड, लोकल इन्फिल्ट्रेशन ऑफ रेबीज इम्यूनोग्लोबुलिन एंड वैक्सीन।
सर नेक्स्ट क्वेश्चन जो है ये किसी डॉक्टर का है, तो वो कह रहे हैं कि जैसे जनरली कुछ पेशेंट 1-2 दिन के बाद आते हैं, तो कैन यू कंसीडर दैट डे एज 0 डे?
यस, यदि मान लीजिए आप देखो सर, यदि फर्स्ट पेशेंट आपके पास आ रहा है, उसने यदि कोई भी वैक्सीन नहीं लगाया है तो वो उसका 0 डे हो गया। आपको लगाना है, ट्रीटमेंट देना है, विद इन 30 डेज आपको सेम प्रोटोकॉल आपको मेंटेन करना है।
जी, थैंक यू डॉक्टर। और कुछ कोई क्वेश्चन है तो? थैंक यू सर, थैंक यू वेरी मच। थैंक यू डॉक्टर गोयल फॉर योर वंडरफुल प्रेजेंटेशन सर।
नमस्कार।
थैंक यू सर।